Today I will discuss with you the pathology of both the gallbladder and the pancreas, the accessory organs with the gastrointestinal tract. To start with, screen for all students. واضحة الشاشة شباب؟
نعم دكتور.
اوكي.
نعم.
صوتك متقطع. To start with the gallbladder pathology, for each organ, congenital anomalies or developmental abnormalities. This is actually a normal, anatomically normal gallbladder composed of the neck and the body and fundus, and this is the greenish lining surface, or called green velvety-like. No stone, no intraluminal stone, no thickening, no fibrosis. This is normal gallbladder. It can be congenitally absent gallbladder, congenital absence or agenesis, ductal duplication or duct duplication of the cystic duct, bilobed gallbladder, bilobed, that is, there is groove in the fundus or invagination in the fundus, yes, or hypoplasia, that is hypoplastic gallbladder or atrophic or completely absent of agenesis. Conditions or diseases of the gallbladder are concerned about cholecystitis, and we will discuss firstly ascending cholangitis, that are infection of the intra and extra hepatic biliary passages. Ascending cholangitis, from its name, ascending, mean that the bacteria enter the biliary passages, common bile duct, cystic duct, through the ampulla of Vater or from the duodenum. When there is obstruction, when there is commonly formed by gallstone, and with associated colonization of bacteria. So ascending cholangitis is acute infection of the bile duct, acute infection of the bile duct, common bile duct, cystic duct, caused by intestinal bacteria ascending from the duodenum. The bacteria causes with this, whenever there is obstruction, bacteria will be superimposed or aggregate to form a focus of separation or infection. With the obstruction of the biliary tree, result in what we call it cholelithiasis, caused by cholelithiasis. Chole, bile related to the gallbladder, or chole for bile, and doco for the common bile duct, and lithiasis is a stone within the common bile duct. So cholelithiasis is a stone within the common bile duct. The risk factor for ascending cholangitis is gallstone formation. This is the most common cause, that is the gallstone lodged or impacted into the common bile duct, or there is a congenital stenosis of the common bile duct, or by obstruction by neoplasm or injury. Injury is mainly caused by endoscopic procedures and surgery. This is the pathophysiology of ascending cholangitis. I will summarize. Whenever there is formation of gallstones, gallstones are formed within the gallbladder, within the bladder itself, gallbladder itself. And whenever there is impaction or lodging of these stones into the, descending down into the common bile duct with the secretion of the bile, with the contraction of the bile, with the contraction of the gallbladder, and to excrete bile secretion, the stones will be lodged, will be impacted in the common bile duct. Here there is formation of obstruction. Whenever there is obstruction, this will facilitate or encourage the ascend or entry of bacteria through the ampulla of Vater into the from the duodenum and upward into the common bile duct and even into the main pancreatic duct. The main bacteria, they are a mixture of enteric organism, E. coli, Klebsiella, Enterococcus, and from the gall and from these the lining epithelium to the bloodstream. From the lining epithelium goes into the bloodstream and causing associated complication, severe complication of septic shock and or called sepsis. High pressure will be induced here in the obstructed common bile duct by the bulging or the expulsion of the secretion and the obstruction here by the stone, impacted stone. شباب أي واحد عنده سؤال، أي واحد عنده تعليق، استفسار، سلايد، قبل لا أحول السلايد اسألوا، لا تترددوا. Don't hesitate, please. Ask at any time. أكو سؤال لحد الآن؟ نقلب السلايد. Okay. Sepsis and septic shock, and in which the focus of infection or the colonization of bacterial passes to the blood from the focus of ascending cholangitis. Laboratory finding, there is evidence of acute infection. White BC is elevated, indicates acute infection or white BC count, and increase in C-reactive protein, protein that is serum protein that can be elevated in acute infection or acute stress. And liver function test, all the enzymes of liver function test, transaminases, alkaline phosphatase, gamma-glutamine transpeptidase are elevated in this in ascending cholangitis. Gallstone is a very common disorder of the gallbladder. Stones are formed or are component of resulting from imbalance of the chemical constituents precipitated out to form solid stones. Mainly, cholesterol stones are the main elevated cholesterol. So there is imbalance when there is excess. For example, cholesterol will be precipitated to form solid stone, and there are certain risk factors and certain precipitating factors. The types. شباب تسمعوني؟ اكو مشكلة بالسمع؟ أحد
بس
يجاوب؟
دكتور أسمعك.
أوكي، واضح الصوت؟
واضح.
تمام. يلا أوكي. شباب, the types of gallstones can be divided according to the site when we call it choledocholithiasis and cholelithiasis. Choledocholithiasis means شنو معناها؟ Stone impacted in the common bile duct, propagated from the gallbladder and through the cystic duct. And cholelithiasis is formation or presence of stone or gallstones within the gallbladder. Or can be divided. So this is according to the site, classification or naming according to the site, and this is according to the type. Cholesterol stone and bilirubin stone are also called pigmented stones. 80% are gallstones are cholesterol stones, and only 20% are pigmented stones, called pigmented because they are either black or dark brown discoloration due to excess bilirubin constituent in these stones. Whereas the most common one is cholesterol stone. Cholesterol stone about 80%, as I said, and composed primarily of cholesterol. There is precipitation of cholesterol or supersaturation of bile. The bile will be supersaturated with cholesterol. And gallbladder stasis is very important, or bile stasis is very important or very essential for formation of stone. Cholesterol stones, because have no calcium content, it is radiolucent. That cannot be seen by X-ray. On X-ray cannot be seen by X-ray. Okay. Whereas pigmented stones are radio opaque because bilirubin is combined with calcium, so they have a calcium constituent. The other type, according to the constituent, is bilirubin stones or pigmented stones, forming up to 20%. Only 20% are pigmented stones, composed primarily of unconjugated bilirubin. Unconjugated, water-insoluble bilirubin. It is seen mainly in patients with hemolytic, long-standing hemolytic anemia or excessive hemolysis, extravascular hemolysis. So excess bilirubin will be bound to calcium to form pigmented stone. This is commonly, this is a stone found in patients with hemolytic anemia, thalassemia, and other types of hemolytic anemia. Okay. This is these are pictures for both the cholesterol and pigmented stone. Cholesterol stone are seen as yellowish multifaceted. called multifaceted يعني هيك شكلها مثلثات أو مربعات كل واحدة بسبب they are formed together, so each one will take the shape of adherent stone. This is a condition, or I haven't seen it before. This is the typical pigmented gallstone. It is black in color. It is formed due to excess unconjugated bilirubin or unconjugated hyperbilirubinemia, when unconjugated bilirubin combined with calcium to form these bilirubin stones. Cholesterol stone are characteristically yellowish, easily fragmented, and we can see here evidence of fibrosis, mucosal ulceration, even infection, and atrophy of the wall, in contrast to in case of hemolytic anemia, no infection is seen here. Or sometimes not only hemolytic anemia can be also seen in case of biliary tract infection, in case of biliary tract infection and obstructive jaundice. So both of these cholesterol and this is a mixed type, so both pigmented and cholesterol stones are seen. It can be related to stasis of the bile and also associated infection, ascending infection of the biliary passages. شباب in general محاضراتنا الباثولوجي we are concerning mainly with the pathogenesis, with the disease evolution, with the formation, with the pathology. So you should give a proper and good concern with the pathogenesis. لازم تفهموا الباثوجينيسيس في محاضراتنا. احنا يعني مرات بنطيه اناتومي شويه وهيستولوجي فقط just to refresh your memory, but pathogenesis and pathological features are the important and that they are the core of our lectures. Cholesterol is water insoluble. It is fat soluble, and it is converted to water soluble by combination with bile salts. لهذا البيشنت اللي عندهم cholesterol stone, they are treated sometimes with ingestion of bile salts to be adequate to combine extra cholesterol. So cholesterol concentration, when it is exceeded the solubilization capacity in bile, becomes nucleated into solid cholesterol stones. And there are three mechanisms important for formation of cholesterol stones. Supersaturation of bile with cholesterol, excess cholesterol as in triglyceridemia, obesity, certain drugs, oral contraceptives, and increased estrogen. So there, we will mention the risk factors later. Cholesterol crystals remain in bile for long time. شنو ذكرنا هسه قبل شوية about this point. Cholesterol crystals remain in bile for long time. Bile stasis is essential. Bile stasis is essential for formation of cholesterol stones, and even if the stones are pigmented with associated infection and obstruction. Presence of calcium salts. Calcium salts serve as a nucleation site for cholesterol stones. Okay, and again, bile stasis is very important for stone formation. These are how can we summarize the clinical presentation of patients with gallstone by remembering the 6 F's: fat or fatty or obese, female, fertile due to excess increased estrogen hormone, fertile for 40, and fatty food intolerance, that is a female presented with pain after or abdominal pain or right upper quadrant pain after fatty meal. due to presence of gallstones, and the gallbladder tried to contract to push the bile for after fatty meal for the process of digestion, and so there is abdominal pain, and that is related to obstruction of the flow and increase in intraductal pressure, and also flatulence due to malabsorption or abdominal distension, and even diarrhea and due to improper fat digestion. Acute cholecystitis, inflammation of the gallbladder, acute cholecystitis, acute inflammation, whereas we will discuss acute inflammation and chronic inflammation. Acute cholecystitis, commonly caused by stone lodged or impacted in the cystic duct, in the neck and in the cystic duct, and into the common bile duct. This results in acute inflammation and accumulation of secretion of bile, and this will be presented as right upper quadrant pain that is characteristically radiated to the back and radiated to the right shoulder, and associated fever and chills, and even rebound tenderness. 90% of these acute cholecystitis will resolve with resolution of the stone or impaction. When the stone goes away or dislodges from the cystic duct, the symptoms of acute cholecystitis will be subsided in 90% of the cases. Again, after fatty meals, the small intestine cholecystokinin signal the gallbladder to secrete bile for fat digestion. The gallbladder contracts and the stone will be lodged with the secretion, with the bile secretion in the cystic duct. This will block the bile flow, obstruction of the bile flow, or common bile duct obstruction. This will irritate the mucosa in the cystic duct, and in the common bile duct, irritate the mucosa. The mucosa secrete a lot of mucus secretion because of irritation, and this will elicit inflammatory process, distension proximal to the obstruction, and increase in intracystic pressure. Cholesterol stone stimulate the inflammation. Cholesterol stone again stimulate inflammation because they are irritant to the mucosa. Pressure also causing pressure on the blood supply of the gallbladder. When there is pressure on the blood supply at the cystic duct or at the gallbladder neck, pressure on the blood supply or on the blood vessel result in ischemia, ischemic changes, and gangrenous necrosis, and weakening of the wall, atrophy, and even rupture and perforation that will result in bacterial sepsis and severe peritonitis, which is a medical or surgical emergency. اوكي شباب لحد الآن so the most common cause of acute cholecystitis هذا احنا نسميها acute cholecystitis. Here it is because it is almost always or most of the case stone lodged or impacted in the cystic duct and common bile duct. So it is also called acute calculus cholecystitis, acute calculus cholecystitis, because it's related to stone formation and its complication and obstruction. whereas about 12%, Shabab, about 12% of cholecystitis is called acalculous cholecystitis, that there is no stone formation or no stone are found in the acutely inflamed gallbladder. No stone within the gallbladder, no stone in the cystic duct, and no obstruction or cystic duct obstruction caused by a stone. It is associated with high morbidity and mortality rate. It is mainly related to shock or stress conditions, especially after surgery. It is difficult to diagnose, and sometimes they are fatal. So about 5 to 10, up to 10% of acute cholecystitis cases, few cases are no stone are formed, and it is called acute acalculous. It is related to stress condition like burn, like surgery, trauma, and so on, and major surgery especially. The pathogenesis here is related to gallbladder ischemia and in cases of shock or major surgery, and after that reperfusion injury and bacterial invasion of the ischemic tissue result in this type of cholecystitis, acalculous type. The chronic cholecystitis, it is related to obstruction or incomplete obstruction of the cystic duct without infection, and sometimes result in inflammation of the wall. It is a constant state or steady state of inflammation or attacks of inflammation, long-standing attacks of inflammation due to gallstones repeatedly blocking the ducts. There are certain microscopical changes in which the mucosa are invaginated downward, causing a deep grooving within the mucosa. So pieces or glands or benign glands are seen invaded downward. Not invasion, it is not invasion, it is type of invagination of the mucosa downward into the submucosa due to repeated contraction of the gallbladder, called Rokitansky, Eshov sinuses, or grooving or deep sinuses into the submucosa. This is an endoscopic view and radiological visualization. This is the endoscopy. This is a process or a tool for, or a method for diagnosis of diseases in the hepatobiliary and pancreaticobiliary tree. It is called ERCP, endoscopic retrograde cholangiopancreatography, to demonstrate the pancreatic duct, common pancreatic duct, and the common bile duct and their cystic duct also. So visualization of the, this is an endoscopy, and here there is visualization of the cystic, of the common bile, the common pancreatic duct. This is the common bile duct, and this is the intrahepatic biliary tree, and this is the cystic duct, and this is the gallbladder, and you can see the cystic duct containing gallstones within the gallbladder and also within the cystic duct. Cystic duct containing multiple stones within the body of the gallbladder and within the cystic duct. Any one of these stones can be lodged downward into the common bile duct and even into the pancreatic main duct and causing a complication of obstruction and superadded infection and bacterial colonization. Cholestasis is hepatic changes of bile stasis or conjugated hyperbilirubinemia, or that is related to obstruction of the extrahepatic biliary passages by gallstones. Again, the 6 F's related to gallstone risk factors. Okay. The risk factors, again, demonstration: female using oral contraceptive, high estrogen in fertile female and fatty female, and increase in cholesterol and bile, and bile hypomotility in pregnancy, in obesity, and hypertriglyceridemia, and all of these increase the risk of gallstones, cholesterol stones especially, obesity, rapid weight loss, imbalance in the bile composition, increase the risk of calcium bilirubin precipitation, so in elevation of the bilirubin, unconjugated hyperbilirubinemia in association or in combination with calcium to result in pigmented or bilirubin stones, and biliary tract infection. Biliary tract infection will be encouraged in case of biliary tract obstruction by a stone or by a tumor or surgery or stricture. Okay. أي سؤال طلاب لحد هنا؟ Any question? Any demonstration? Okay.
Doctora, regarding bilirubin stone, why we call the pigmented stone?
Pigmented because it is seen as dark color, even either black discoloration or dark brown discoloration associated with biliary passages infection or infection of the biliary passages, and or black. شوفيها شكلها black يعني related to hyperbilirubinemia or unconjugated hyperbilirubinemia or hemolysis when unconjugated hyperbilirubinemia combined with calcium. Pigmented لأن either dark brown or black in color. مو مثل الكوليسترول stone. الكوليسترول هذه شكلها yellowish discoloration due to excess cholesterol content. Okay, and you identify here the laceration and mucosal ulceration, fibrosis, and thinning of the wall. Okay. Any question, Shabab?